Hi everyone, I'm Julianne Mardaly, part of the Lurie Children's social media team, and today I'm joined by Dr. Cynthia LaBella and athletic trainer Madeline McHugh. They're from our Institute for Sports Medicine here at Lurie Children's. With back to school in full gear now and the start of sports seasons for many of our young adults and young teens, we thought it might be a good time to start talking about knee injuries, how to prevent them, ACL tears, particularly ACL tears, and our knee injury prevention program here at Lurie Children's. So to get things started, we'd like to know exactly what the ACL is, what does it stand for, and where is it located in your knee?
Sure. ACL stands for anterior cruciate ligament. It's one of the main stabilizers of the knee joint, and I can pull out my handy knee model here. So you have 4 major ligaments in your knee, 2 on the outside and 2 on the inside, and the ACL lives deep inside the knee. So if we pull the kneecap away so we can see inside, the ACL is this ligament right here in front.
And what is its role for the knee?
So the ACL is an important stabilizer for the knee, especially during sports that involve landing from a jump, changing direction when you're on the field, to prevent the knee from shifting out of place, or when you go to turn so that your thigh bone doesn't twist all the way on your shin bone. So it keeps the knee stable and from giving out when you're doing sports.
And so when someone tears their ACL, essentially your knee loses stabilization.
Your knee loses some stability, so that when you do attempt to do a jump landing or a change of direction without an ACL, there's a greater chance that your knee will give way and buckle and you'll fall. Or more importantly, if your knee gives way and buckles without an ACL, you can injure other structures in the knee. Importantly, these 2 shock absorber pads here are called the meniscus, and you've got 2 in your knee, and they're very important for cushioning the knee joint and helping to keep it stable as well. But when you injure this meniscus, that can set you up for even more of a chance for arthritis down the road as an adult. So without an ACL, increases your risk for additional injury to the knee.
Okay. When, like I mentioned, school is in full gear. There's a lot of sports starting. What are some common sports that you see the ACL tear? Soccer? What are more common sports?
Sure. So I mentioned sports that require landing from a jump and changing direction quickly. So the top sports where we see ACL injuries are soccer, basketball, volleyball, football, gymnastics. So those are just to name kind of the top ones. And when we look at all sports where boys and girls both play, and where they have the same rules, so soccer is an example, basketball is an example, the ACL injury rates in girls, especially at the high school level, are 2 to 6 times higher than in boys for the same sport.
Why are girls more prone to injury?
So that's a great question. A lot of research has gone into looking at why girls tend, at the high school level anyway, tend to be more at risk for ACL injury. And the overwhelming data points to neuromuscular factors that are different between girls and boys. And that's a fancy way of saying that girls just use their muscles differently when they play sports than boys do. So when girls are landing from a jump or changing direction on the field, they're using their muscles in their legs and their core a little bit differently than boys are. And the thought is that the way that the girls are using their muscles is not as protective for the knee and the ACL.
Okay. So when the ACL tears, what does recovery look like? Is surgery your only option? Tell us a little bit about that.
Sure. So when someone tears their ACL, ligaments do not heal on their own if they're completely torn. So the 2 ends do not, they pull away from each other in the knee, so they're not close enough for there to be any healing. Even with some ACL injuries where the ligament is only partially torn, so part of it is intact. Oftentimes, that is not strong enough to be functional when you're playing basketball or playing soccer to stabilize your knee. So even for someone who's partially torn their ACL, oftentimes they're left with a knee that's not very stable. And so your options are, well, you can choose perhaps not to play a demanding sport on the knee and do something that puts less demand on your knee for stability. But if you're really passionate about that sport and you really want to continue to be active in soccer, basketball, etc., the best option is to have that ACL surgically reconstructed.
And what does the surgery look like? Is it intense, minimally invasive, recovery time?
The surgery is done through the scope, so it's an arthroscopy surgery. The gold standard, what we call the main procedure that we use for repairing the ACL, is to take a piece of the patient's patellar tendon, so that's the kneecap tendon, and use that to make a new ligament, new ACL ligament, and they can do this all through the scope. It's typically an outpatient surgery. There's no overnight hospital stay, and there's maybe less than 2 weeks where you are potentially in a brace or non-weight bearing, but we try to get that knee moving as quickly as possible, and the rehab starts pretty much right away after surgery. The rehab is several months, and typically it's a minimum of 6 to 8 months before a typical adolescent is ready to return to some form of sports after an ACL surgery. So there's a lot of rehab involved in terms of getting your motion back in your knee and strengthening all the muscles that are necessary to support the knee and do those sports.
So after recovery, are you more likely or more prone to tear your ACL again?
Well, that's a great question. There have been a lot of research studies that have looked at what are the risk factors for tearing your ACL. And unfortunately, once you've torn your ACL, that is a risk factor for tearing it again. And interestingly, you're more at risk for tearing the ACL in the other knee, the non-operated knee, than tearing the graft that was put in your the original knee.
Is that just because you're probably using more of the other knee or leg?
So there's probably a few factors playing a role. One is that, so first you've already torn one ACL, right? So you already have a collection of risk factors that may not have changed in between your first injury and the second injury. So so a couple of risk factors are if you play a high-risk sport, soccer or basketball, if you're female, if you have those muscle firing patterns that I identified earlier, where you're using your muscles in a way that doesn't protect the knee. If we don't address those things during the rehab process, then that other knee is still going to be at risk for ACL injury. But it could also be that that knee is when you go back to sports, you're kind of favoring the good knee because you're more confident with that knee. So you might tend to do more of your jump landing or running or cutting using that leg, the uninjured leg. And so you might be putting it in harm's way more frequently.
So are there long-term consequences if a teen tears their ACL going into adulthood, further down the road?
Yes, and that's a very important question because we talk a lot about surgery and how to fix the ACL, but unfortunately, just tearing your ACL, regardless of whether you have the ACL reconstructed or not, just tearing your ACL puts you at 10 times greater risk for early degenerative arthritis in that injured knee compared to the uninjured knee. And what we're talking about in terms of early degenerative arthritis is that studies show that we can see signs of arthritis starting as early as 15 years after the injury. So for an adolescent who tears their ACL when they're 15 or 16, we're talking about arthritis in that knee in their 30s.
Yes.
Important fact.
Is there a way to prevent that, or is it just the course of what happens?
Well, we would like to focus on preventing the initial injury. Right. In terms of once you've injured your ACL, is there a way to prevent that long-term arthritis? Well, I think we counsel our patients who've torn their ACL a lot on activity selection and the importance of keeping your muscles strong and coordinated so that when you do choose a sport or activity that's high risk for a knee injury, that you're taking every action you can to reduce that risk of additional injury to the knee, and also the wear and tear on that knee.
So is there a difference in treatment for a child versus an adult for an ACL tear?
There are some different types of surgeries that are done for children with ACL tears who are not yet what we call skeletally mature. So if they still have bone growth left, or more growing to do in their bones, their growth plates are open, and the procedure that is done to repair the ACL is very close to where the growth plates live in the knee. So here. As I mentioned, the surgery involves taking a small section of the kneecap tendon, and then inserting it into the knee joint where the ACL was. But the process of inserting it, they have to drill through both the tibia and the femur, and right in the area where the growth plate lives is where they would have to drill. So for someone who's an adult or who's an older adolescent whose growth plates have already closed, then that's a safe procedure to do. However, if the growth plates are still open, it requires a modified procedure that avoids the growth plates, in which case a pediatric orthopedic surgeon is really the best choice for that procedure, because they're the ones that are skilled in treating that population of kids who are not yet mature, still have open growth plates.
And then you mentioned that the ACL is repaired with the tendon.
Yes.
What's the difference for our viewers between a tendon and a ligament?
Okay.
So and why can the tendon repair a ligament?
Right. So they're both made of similar type of tissue. It's a fibrous type tissue.
Okay.
But the role of a tendon is to connect a bone to a muscle, and the role of a ligament is to connect a bone to another bone. So that's the difference.
Great. And so Madeline, Madeline is an athletic trainer for our Institute for Sports Medicine, and she leads a program, the Knee Injury Prevention Program here at Lurie Children's. And tell us a little bit about that program.
So the Knee Injury Prevention Program is a series of plyometric exercises, so different jumps and hops that become more and more difficult throughout the program, as well as core and lower extremity strengthening exercises. And all of these exercises were chosen by our physicians and physical therapists that are designed to target the areas that fix these neuromuscular, or the way we're talking about how girls are landing from jumps, their form when they're doing squats, things like that. They're all designed to correct those issues that are causing these knee injuries.
And so you travel around to provide this training to girls in sports on proper ways to jump, land. What success have you seen from the program?
So the program we actually use in a couple different ways. Sometimes I'll go out and teach an entire team and their coach how to utilize it for a 10-minute warm-up. So for practices and game days, the exercises are put into a specific order so that they use all the different exercises. And that way it takes about 10 minutes, it warms them up, but then it also is teaching them proper form and strengthening. But the key is making sure that their coaches understand how to critique it and make sure the kids are doing it right, because if they're not doing proper form, then it's barely even a warm-up. So they have to be doing them correctly. Other way we use it is a 6-week course where I rent out a space in different areas around Chicago is where we've been doing it recently. And for free, girls get to come twice a week for 1 hour for 6 weeks total, and they run through the entire program. So it takes the entire hour usually. And part of that program is they usually participate, as long as they want to, in our research, which we've had great results with. So it's still ongoing, but at the beginning of the course on the first day, we have the girls do a LESS test where they jump off of a box. and I kind of look at their form and how they're landing the jumps, and they get a score. And then they also do a single leg hop, and we measure the distance and average that, and then they do it again at the end of the course, and so far everyone has showed great improvements. So that's been really great. Our website, we have a KIPP for Coaches training website, so they can actually go through and learn all the information, all the exercises, and it's free for them to go through the training. At the end, they get a little certificate, and it gives them the card, which looks just like this, that they can keep with them so that they can use it for practices and game days, and it has all the exercises listed. We've recently started some new partnerships with Girls in the Game. I would go out and actually run it for their camps and teach the girls the program there. And we're hopefully going to be working with them more in the future, as well as we've got some new relationships with the park districts. So they've been helping us by giving us good discounts on utilizing spaces to teach the programs, as well as helping us advertise to their kids. And then we've even started working with Hubbard Street Dance Studio.
Very cool.
Yeah.
So if I'm a volleyball coach, I can just find information on the Lurie Children's website if I search knee injury prevention program?
Absolutely, and there's links to different ways to learn about, because KIPP is offered in so many different ways. You can also just email KIPP, it's just KIPP at luriechildrens.org, and those emails all come to me, and I can respond with more information and more links. The website for the coach training is actually kipp.instituteforsportsmedicine.org. But you can find that through our Lurie website.
And I'll post this in the comment section at the end of the broadcast. And you mentioned it's free.
Yes, so we've been fortunate enough to, in the past, have Kohl's fund us, which enabled us to teach this program for free and offer our website for free and all these great things. We are currently looking for some more funds for the future, because we would like to still be able to offer this program at no cost to the community.
And then you mentioned it's for girls, but can boys participate as well?
It is targeted for girls, as Dr. LaBella mentioned all of their risk factors, but it is still very helpful for boys as well. It doesn't just prevent ACL tears, so the knee injury prevention program is also shown to prevent ankle sprains, as well as like patellofemoral or generalized knee pain, which can be very beneficial for boys as well. We have had a couple come through. I don't necessarily seek out to target them as much, but they are always welcome.
Well, can you demonstrate some proper exercises that you might teach in one of the KIPP trainings?
Yes, so I have brought with me one of our other athletic trainers, Christy McCracken, and she's going to help show some of these exercises, as well as some of the proper form and what we do see a lot and how to correct it. So one of the first ones that we do is, there's multiple things in the warm-up. I'm probably not going to go through all of them, but you can see all of them on the website. But during the general warm-up for practice and game days, leg swings is actually one of the most important warm-up parts, because it helps stretch them out, but it also acts as a stabilizer. So we don't like the kids to hold on to fences or anything when they're doing this, because as you can see when she's standing here, she's firing her whole left leg to keep balance. So we do front to back and then side to side as well. And usually at the beginning, the kids actually really struggle to stay up and do this, but by the end of the course, they can do it for a full 30 seconds. So each one of the exercises in our warm-up are all either 30 seconds or supposed to be traveling for 50 feet. So usually like the length of a basketball court or a tennis court, or they can use half of a gym if they like. So one of the next ones we've got, we'll try and do all the standing ones while she's standing, is lunges. So they can do walking lunges or in place for 30 seconds, depending on the space availability. So this would be an improper lunge. Her knee is coming in front of her toe. Her front foot is crooked. Other than that, it actually is pretty good though. So we would actually have her straighten out. So we'll have her show a proper. Want to go this way for me actually? Yeah, perfect. So this lunge is perfect. Both her knees are bent. This knee is not coming in front of the toe. Both her feet are straight. She came down pretty deep. So this is a great lunge. Another one we would do is squats, which is a basis for a lot of these jumps and hops and landings. So this is a really important one. So if you could show us a bad squat. So I know this looks terrible, but this, when you ask a kid to do a squat really quickly, this is what you see a lot. So her knees are coming in. This is a risk factor. Her toes are coming in. She's way in front. She's not engaging her hamstrings. So now show us proper squat. Perfect. So she's shoulder width apart, her butt is back, her knees are not in front of her toes are nice and straight, she's engaging her hamstrings, her glutes, and her hips to hold that squat. So we just have them go progressively up and down for 30 seconds. Another one we've got is squat jumps. So from the side, she'll show you this one. So squat jumps is just a progression of squatting down, jumping straight up, and then landing it into another squat. Yep, so it's just a progressive, keep going. So on this one, she's doing it perfect. But if we look at her from the front this time, a common error is the girls will come down. Once they start doing their squats quickly and they're not thinking about it, this is what happens.
And I feel like this is a common move in volleyball.
Very
It's probably
common.
where a lot of injuries occur.
Exactly. So we like to make sure that I'd rather them do these exercises slowly and correctly, so it's not a race, because I want them to be able to have time to think about it. Another one would be a broad jump. So if you want to do one, we'll ever do one sideways and one forwards. Good, so that was a pretty good broad jump. The common errors we see when they do these are usually they'll jump forward and land to one side. I'm exaggerating a little bit, but when you watch them closely, they'll use that leg dominance, which is a risk factor, and they'll lean to that side, as well as their core will be weak on one side, and they will lean. So when they're doing it quickly, you have to really watch to see it. So we like to tell them to take their time on those. We also have planks on here. So
Not
when they-
elbows?
yeah, they're allowed. Planks are acceptable on forearms or on upper arms. So this would be a bad plank. She's got her butt way up in the air, so we like everything to be nice and straight line. So they should be flexing their core when they do this. I always have to come around almost everyone's hunchback. We tell them to pinch their shoulder blades together. That pulls the core in a little bit tighter. Their shoulder should be directly over their elbow. And then if they are on forearms, we never want hands locked, because that also pulls the shoulder blades apart a little bit. So this is a great plank. As long as you're down there, do you want to show us the side plank?
Sure.
So this is another one that actually kids struggle with just to hold for 30 seconds. So to keep the hip not from going way too up high, like this, or letting it drop all the way almost to the floor, these are all improper planks. A lot of times they'll try and lean forward. We want the shoulders to be back, so the shoulders should be nice and straight above each other. She's been down there a while, you can go ahead and get up. Those are difficult. So we make sure they do both sides for 30 seconds. So ice skaters, this is really a one-legged squat that we have them balance back and forth, essentially. I make sure they go slow because I want them to balance on each foot each time. It's not speed skating necessarily. So we want them to make sure they're engaging their hip, their knee is not coming in front of their toe, and that they're actually pushing off. So the higher they jump and the further they jump side to side, the more difficult it is. So, and that's okay. When they lose balance, that means they're just trying. So as long as they come back and just keep focusing and the form is okay, that's fine. So 180 jumps is another one of our jumps where we start in what we call our athletic position, which is actually just a mini squat. So just like this. So she starts in her mini squat and then she does a 180 jump, or essentially a half turn. The key for them here is to make sure they're landing in that proper squat. And then when they're jumping up, they go straight up. That helps to keep their knees in proper form. As well as I tell them, if they can, to first look down, and when they do their first couple jumps, make sure their feet are landing fairly close to where they started. So they're not starting here and then coming all the way over here. Last couple ones we'll go through on here is scissors jump. So this one's just jumping lunges. So these are pretty good. And they can be, small is okay as long as their knee isn't coming in front of their toe. And I tell them to take their time. It's okay to go slow if the form is good, but once they get better, they really start jumping. Last one that we'll go over is just called hop, hop, stick. So this is just 2 single leg hops with a quick progression to the second one, and they stick the landing. So when she does this jump, you can see she actually lands on her toes. So when we have them do these jumps, almost every single one, the weight should be in the back of the heels, because that helps you keep your butt back and engage the hamstrings, and not let the knee go in front of the toe. So we'll have her do it one more time. So when she lands on her heel, you can see she looks more like she's sitting in an imaginary chair. That's the form that we look for with that. I tell them to keep the hops a little small. If they're too big, they usually can't stick the landing.
Right.
So
Great. Thank you, Kristen. You're a great demonstrator. And Madeline, so you mentioned that this program is 6 weeks, but ideally this is something that coaches and the teens take on for the rest of their life, right? And it's a warm-up, ideally before a practice or a game.
Right, so if they use it as the warm-up, essentially we like them to use it for the entire season, and it does have the same effects as the 6-week course, But the 6-week course, we found that the effects of KIPP and like learning all of that can be lost within about 4 months if they're not doing maintenance exercises. So maybe if they did the KIPP course and then their team was using this as a warm-up, they would be absolutely fine. Or if they do the maintenance program on their own after, they can maintain what they've learned and the strength that they've gained. But for a coach's team, you would essentially want to use it every season.
And just to remind our viewers, how do you sign up for KIPP? How is it offered? And where can you find more information?
So we offer it multiple times a year at different locations. So you can always email me at kipp@luriechildrens.org, or you can call our office, which is just 312-227-6190, and they'll refer you over to me. And I'll give you any information about the current locations of KIPP, when we're going to be having our next one, and I can take your information and always let you know if there's an upcoming one that might be closer to you. Or I can always reach out to your coaches if you have any coaches you wanted me to talk with and teach them the program for free.
Great. And we do have one question. My niece tore her ACL playing basketball. She did not need surgery. Is this common?
Well, like I said, surgery is an optional way to treat an ACL injury, and not everybody is a candidate for surgery or may need surgery. But it's best to talk with a pediatric orthopedic surgeon who has a lot of experience treating this injury to help guide you in this decision.
To the right course.
Exactly.
Okay. Well, I think that about wraps it up, but we did want to touch on, you guys are part of the Institute for Sports Medicine at Lurie Children's. Can you tell us a little bit about the Institute, where you see patients?
Sure. So the Institute is a word that's a little misleading because it's not a building. It's a group of individuals, physicians who are especially trained in pediatric sports medicine, as well as athletic trainers and physical therapists and other staff that support treating both musculoskeletal injuries that children experience when they're playing sports, but also things like concussions and medical concerns of young athletes. So we are very broad in our focus. We don't just focus on one sport or one type of injury. We see kids of all ages from all types of physical activities with various injuries. And we're in various locations.
Right.
Lurie has a number of outpatient centers, and we are in, there's someone from the Institute for Sports Medicine at almost all of them.
So for location information, I'll also share that on Facebook after this broadcast, but you can find the information as well at luriechildrens.org. Thank you so much, Dr. LaBella and Madeline. This was great.
Thank you.